So next up is our honoree, Dr. Christina Ghaly, who received a public sector award along with the CIO, Kevin Lynch. Dr. Ghaly is a director of the LA County Department of Health Services. Now, DHS is the second largest municipal health system in the US and serves over 750,000 unique patients through its network and has a budget of $6.2 billion. DHS provides healthcare services to youth in the juvenile system, justice system, and inmates in LA County jails. And I didn't know this before, but DHS also runs the EMS agency and the county's 911 emergency response system. So Dr. Ghaly is being honored tonight for making critical data public and preparing the county's healthcare system for a wide range of pandemic response scenarios. And you probably saw her on TV like I did almost every day, informing us about COVID-19 and guidelines for creating safe work environments and getting tested for the virus. And quite frankly, Dr. Ghaly and the 22,000 staff at 26 health centers and 4 acute hospitals have been busy saving lives. And in the middle of all that, she still currently sees urgent care patients at LAC USC Medical Center and at Olive View UCLA Medical Center. So please join me in congratulating our Innovate at UCLA Public Sector Award winner, Dr. Christina Ghaly, and she is joined by her CIO, Kevin Lynch.
Thank you so much. It's a pleasure to be here, and I want to extend my thanks to the entire Innovate at UCLA team and the executive board. It's really an honor. And I must say I'm honored also by the fact that there is a public sector service award. For most of my life before the Department of Health Services, which I joined in 2011, I worked in the private sector. And I had no idea what was coming when I shifted over into the public sector service in 2011. It is night and day different, for better or for worse. It's just a different beast, but it is a mission that is unbeatable within the County of Los Angeles and certainly within the Department of Health Services. And I'm so excited to be part of the team there. Technology is obviously a huge part of what we do as a health system. We operate 4 hospitals, we have 27 clinics. We have a number of other services, some of which Thomas just mentioned, and we couldn't do what we do without technology. It's absolutely the backbone of how we operate as a health system. And all the more so really when COVID hit in March, we were able to deploy a large number of our staff who aren't engaged in direct patient care into telework virtually really overnight, just as many organizations did. We had to ramp up also very quickly what Thomas mentioned, which was the hospital bed demand model, which we've continued to put out weekly. We have a team of individuals, epidemiologists, who are looking at hospitalization rates and using a variety of statistical methods to monitor the trends in those rates and be able to make projections about bed capacity across the entire LA County system, including both public and private hospitals. And this is key because we need to be able to anticipate where the volume is going. We all know that hospitalizations lag behind COVID cases by about 2 to 3 weeks. But we also know that those hospitals need time to prepare. We need to know how much staff is needed, personal protective equipment, supplies, everything. And so that bed demand model has been really helpful for us in the county and helping to prepare for what's to come. We also simultaneously obviously had to care for patients with COVID. We've cared for over 3,000 patients to date who are hospitalized just in our own 4 hospitals, not to mention thousands of additional patients who thankfully did not require inpatient hospitalization within our system. We've also had to continue to provide services to patients without COVID, and that required shifting a huge amount of our services telehealth wherever possible. So right now we're still providing about 90% of our primary care visits by telehealth modalities and a large number of our specialty care services as well. And then finally, we were asked to take responsibility for the county's community COVID testing response, which we took over in April after really an immense amount of work that had been done initially by the LA County Fire Department. And since April, we've been working on ramping up testing across a variety of sites in the county, offering literally thousands and thousands of tests every day, and technology has been key there as well. We have built a registration platform that's been streamlined so people have an easier time getting signed up for a test at a county COVID testing site. We've also revamped the results notification process so that people can get their results by logging into a platform more easily. We're working on adapted contact tracing mechanisms in partnership with our sister departments of Department of Public Health, so that people can be able to notify anonymously their contacts if they have received a positive COVID test through one of the LA County operated testing sites. Obviously, there's more I could say. We've worked on getting IT interfaces into the jail so that the patients who are being screened, quarantined, and isolated in the LA County jail system have timely access to their COVID test results. We've also been taking the lead on outreach and engagement in COVID testing among the homeless population for persons experiencing homelessness. So we have street outreach workers on the ground able to track patients. They know where to find them, and they can track them through a variety of IT tools so that we can get COVID testing out to that very vulnerable population, whether they're sheltered or unsheltered. I could say more, but I just wanted to say thank you so much for this award. I also want to extend thanks really to my entire team. No one does any of this work alone, and I have an outstanding team behind me within DHS. Chief among them is our Chief Information Officer, Kevin Lynch, who is here today, and I will turn it over to him to say a few words.
Thank you, Dr. Ghaly, and thank you, everyone. I'm Kevin Lynch, the Chief Information Officer for Los Angeles County Department of Health Services. And Dr. Ghaly is truly a personal inspiration to me on how she is committed to leading the second largest public health system in the nation and serving the patients we care for. She's very mission-driven. Dr. Ghaly supports and leverages technology to advance innovation in healthcare information technology, including adding IT innovation as part of the fabric of our strategic initiatives that we track for every year. We pivoted to focus on virtual health as we reacted to the surge in COVID-19 patients, and we have increased the numbers of both phone and video visits with our patients, lowering both the exposures to our providers and for our patients. Significantly changing the way we provide patient care. She's also been a leader in advancing telework options that allow our staff to safely and securely and effectively access our IT systems remotely, also lowering exposure for these IT resources. We've included iPads in our acute care centers to communicate between patients in isolations and their family members when they can't physically get together. Dr. Ghaly has been leading and supporting these innovative efforts to leverage technology to help improve patient care with our workforce and our expanding patient population. Her efforts are really making a big difference, and congratulations, Dr. Ghaly.
You too, Kevin.
Thank you so much to both of you. I mean, like I said, we're just so humbled you're here with us tonight. We really appreciate what both of you do to help keep our families, to keep our businesses, and to keep our community safe and healthy. So again, congratulations on this award, and we look forward to seeing you on, hopefully, no offense, less so on TV about the virus, but more so for other areas. But thank you again.
Thank you so much.